attack occurs, the blood vessel that typically feeds the heart with blood and oxygen becomes blocked with a slow buildup of mostly cholesterol, sometimes blood. When the clot develops, the heart muscle dies. Time is muscle, and it's a statement that all emergency care personnel know and use frequently. Society believes that heart disease is a man's disease, and that's not necessarily the case. Because of that, women don't seek medical attention, and because of their symptoms, their differing symptoms, they don't seek medical care for heart attack because they don't think that that's what they're having, because this is a man's disease. This isn't my disease. For any concerning symptom, concerning for you, if something's different, if something's off, if you're not feeling well, if you're not feeling right, seek medical attention.
As every minute counts when it comes to having a heart attack, it seems that getting to the emergency room as soon as possible would be everyone's first choice. Unfortunately, over 50% of all patients experiencing chest pain drive themselves to the nearest hospital rather than calling 911. The reasons for this are numerous, ranging from the instinct to jumping into the vehicle and driving to the nearest hospital, to the misunderstanding that emergency squad is only a transport vehicle. The fact remains that every minute counts when it comes to having a heart attack, and calling 911 is the best option. 911 dispatchers are trained to not only locate you quickly, but to assist you in early treatment options. In partnerships with the medics and the doctors at local hospitals, we hope to get you the best service that you need.
When someone calls 911 and we go to their house, we're able to start treatment on people immediately. So we can determine whether or not they're having a heart attack. We can take an EKG, and with that we can transmit it to the hospital so the doctor can look at it as well, and then between the two of us, when we talk on the phone, we can diagnose their problem and start treatment immediately. So we can start IVs and start giving them medications that both relieve the pain and slow down the process. When you're having a heart attack, it's all about time. The time is muscle, they like to say. So the longer you wait, the more muscle and tissue in your heart that is dying. So the faster you can get treatment, the better. So by calling 911, we can get there fast, we can start treatment immediately, and we can transport you to the hospital. And rather than waiting in the lobby, you're going to go straight in, see a doctor immediately.
The whole time that you're with us, we have a recorded EKG of everything that's happened. So if what we give you helps you and it shows up on the EKG, the doc can see all that in a time frame. If we get there and we decide that, you know, it's not a big deal, you're not out anything, we can at least help people out to the car and they can facilitate themselves to drive in. But if it is a cardiac issue, there's great benefit in having us come. We can save quite a bit of time.
You don't ever need to be embarrassed or worried that we should be doing something more important. The most important thing we have to do is take care of the person who's calling us.